Hello YouTube. Welcome to Dr. Vibes, a learning point.
So in today's video, I will discuss about the important topics in general pharmacology. Now I did not get a time to discuss each and every topic in detail. So I have mentioned all the important topics. You go through your book, and if you find difficulty in any of the topics in understanding, then we can make a video about that, and so that your problems will be solved. So first, you should remember some of the WHO definitions. They are asked in your exams. Definition of drug, ADR, pharmacovigilance, and essential medicines. These four definitions of WHO are primarily asked. Then you have some other definitions or other concepts like the volume of distribution, biotransformation, bioavailability and equivalence, clearance, loading and maintenance dose, plasma half-life, pharmacogenetics and pharmacogenomics. Okay. Next we move on to pharmacokinetic parameters. So absorption, distribution, metabolism and excretion. All those factors which affect distribution, which affect volume of distribution, which affect metabolism and which affect excretion of the drug are important, because they will ultimately modify the drug action. So there is one question, what are the factors which modify the drug action? So your answer will be based on this. Now, under distribution you also have to know the factors which affect the bioavailability of the drug. And under metabolism, you should know about phase 1 and phase 2 reactions in detail and the examples of enzyme inducers and inhibitors. Now, pharmacodynamics, we should know about receptors, dose response curve, agonists and antagonists, and various drug-drug interactions like synergism, like antagonism, etc. Pharmacovigilance in ADRs, you should know about the types of ADRs and the importance of pharmacovigilance, and finally the pharmacovigilance program of India. Clinical trials, that means how a drug is developed. There are basically 4 phases of clinical trials, and a general overview of those trials are required. And finally, there is a short topic called as therapeutic drug monitoring, but this is, being a short topic, a very important topic. So these are the must-know topics of general pharmacology which will be utilized through your entire pharmacology. So you should know all these. So if any doubt you have, you can comment below and I will try to make a video on that and solve your queries. Okay? Now let us discuss some of the few clinical questions related to general pharmacology, and you find any difficulty or you couldn't solve one, then also you can comment below and then we will make a video about that. So the first question is, a patient with nephrotic syndrome and hypoalbuminemia comes to your chamber. So the question is saying protein binding of which drug is least likely to be affected. So it is said that the patient is having hypoalbuminemia. That means there is less concentration of albumin in your plasma, in the patient's plasma. So protein binding of which drug is least likely to be affected. So those drugs which are least bounded to albumin will be least affected, right? So diazepam, we know that it is highly bound to albumin. Approximately 90% it is bound to albumin. Morphine, it is bound 35% to albumin, so it is relatively less. Valproic acid and warfarin, again 90%, almost 90% bounded to albumin. Now albumin is a plasma protein to which acidic drugs are bound. So valproic acid, warfarin and diazepam, these are bound to albumin. Morphine is just 35% bound. So the protein binding of morphine is least likely to be affected. So in this question, you should know about the concept of different plasma proteins and which drugs are bound to plasma proteins. Okay. Next question. A newborn baby was born with phocomelia. It results due to a drug taken by mother during pregnancy. Which medicine has the mother taken? So phocomelia is a condition in which there is undeveloped lower limbs and upper limbs and there is fusion of the fingers. Okay. So this is a factual question that if a mother has taken thalidomide during pregnancy, then the newborn baby will present with phocomelia. So answer should be thalidomide. Okay. Next question. Diamox is given to a patient with glaucoma. It is a non-competitive inhibitor of chronic anhydrase enzyme. Which of the following would be affected by this drug, or which would be the effect of this drug? So we can see this is a non-competitive inhibition. Even if you don't know about Diamox or glaucoma, we have read this in biochemistry in your first year, that non-competitive inhibitors will affect Vmax, but they do not affect Km. What happens to Vmax? Vmax decrease in case of non-competitive inhibitor. Why? Because this inhibitor binds to a site which is different from the active site and will hamper or inhibit the activity. So what will happen? There will be decrease in Vmax, decrease in Km, decrease in both Vmax and no change in Vmax. So there should be a decrease in Vmax. No, there is no change in Km. As I said here, no change in Km. Okay, let us do the last question now. What instruction would you give to a lactating mother and the one who is taking medications? Now, it is said that no advice to be given to the mother. Avoid breastfeeding Medications to be taken 3 to 4 hours before the next breastfeeding, and medications can be taken anytime. So the answer to this question is that medication should be taken 3 to 4 hours before the next breastfeeding. Now if a mother has taken a medicine now, in next 3 to 4 hours, the peak plasma concentration of the drug would have almost reached and subsided. So if the mother feeds her baby after 3 to 4 hours, then the plasma concentration of the drug is not very high. So there are very less chances that drug will go to the fetus. So that should be the ideal time when her mother should breastfeed her baby. That is 3 to 4 hours after taking the medication. Now, I have discussed a few important MCQs. I have discussed the important topics. Your duty is to go through them, go through a book, and if you have any doubt in understanding any of the topics, you can message me, comment me below. Thank you.